Now let's look at diagnostic summary. Diagnostic summary is basically the summary of your findings after you have done the orthodontic screening or examination and diagnosis of a patient. It contains all the important features of the specific patient. Here is a template. So if you look at the flow of the template, the order of the summary follows the order of your END or screening. This ensures that you don't miss any information. So now let's go through the summary. The first sentence contains the age, the complaint, the type of malocclusion, and the skeletal assessment. So for example, this is a 10-year-old Malay female came with a complaint of teeth jutting out. She presents with a Class 2 Division 1 malocclusion on a Class 2 skeletal pattern with increased FMPA. If the patient has a facial asymmetry, so then you should mention there is a facial asymmetry where chin point is deviated to the right or to the left. Next sentence contains all the dental anomalies such as impacted tooth, hypodontia, and significant tooth conditions such as caries, periodontal condition, RCT, crown, and others. So if the patient have any of those features, you can present, like for example, there is an impacted 1-3 and congenitally missing 1-2 and 2-2. There's caries on 4-6 and root treated of tooth 3-6. Next, you will describe the crowding or the spacing. Please only mention the amount of crowding and spacing. Do not mention rotation, displacement, and others. So for example, you must present like in the lower arch, there is moderate crowding of the labial segment and mild irregularities of the buccal segment. In the upper arch, there is mild spacing in the labial segment and fairly well aligned buccal segment. Next is the interarch relationship. So just follow the sequence of overjet, overbite, anterior open bite, midline, molar relationship, canine relationship, crossbite, and scissors bite. So you will go like in occlusion, the overjet is increased at 7 millimeters and the overbite is reduced at 10%, complete to teeth and atraumatic. There is an anterior open bite of 2 millimeters from 1-3 to 2-3 if there is an open bite. The upper midline is shifted to the left and the lower midline is shifted to the right. Okay, if the midline are coincident, then please state the upper and lower midlines are coincident. Canine relationship is Class 2, quarter unit on the right, and Class 1 on the left. Molar relationship is Class 2 full unit bilaterally. There is a crossbite on 1-2 and 2-2 associated with anterior mandibular displacement. There is a scissors bite on 2-4 and 2-7. Again, this is only a guide, therefore what information you put in the summary is purely based on findings of that specific patient. Hope this helps. Thank you. Next, let's look at etiology. I hope you all do remember that etiology consists of general factors and local factors. So based on your orthodontic screening or examination and diagnosis of that specific patient, please list and explain all the etiology associated with the malocclusion of the patient. Thank you.
For problem list, you have to list down all the problems that you have encountered during examination of the patient. For example, poor oral hygiene, caries on which tooth or teeth, skeletal pattern, impacted canine, hypodontia, and so on. For canine and molar relationship, please specify which side is the problem. It can be either one side or both sides. And remember to state the unit. Quarter unit, half unit, three-quarter unit, or full unit. Please remember, a normal relationship such as Class 1 canine relationship, Class 1 molar relationship, and Class 1 skeletal pattern are not categorized as problems and should not be in the problem list. Aims of treatment. Aims of treatment is actually stating what you are going to do with the problems in the problem list, and it must be listed in the same sequence as in the problem list. For example, number 1 problem in the problem list is poor oral hygiene. So the aim of treatment is to improve the oral hygiene and placed as number 1. This is followed by to restore the caries on which tooth or teeth, to accept or to correct the skeletal pattern, surgical remove or expose the impacted canine, and so on. As you can see on the screen, all the problems in the problem list are addressed in the aims of treatment and following the sequence. Treatment plan. Treatment plan can be divided into two parts, general treatment plan and orthodontic treatment plan. For general treatment plan, the first is oral hygiene instruction and oral hygiene education. If the patient has other specific problems, such as caries or periodontal problem, you need to refer the patient to other specialty for the management. For example, refer to conservative department for management of caries on 2-4 occlusal and 3-6 buccal. For orthodontic treatment plan, you have to determine the appliance that is suitable for the patient based on the patient complaint and all the findings during the examination, whether the problem can be solved by using removable appliance, fixed appliance, functional appliance, or retainer. For treatment that requires removable appliance, functional appliance, or retainer, you need to specify the design, give justification and function of the components in the appliance.
Okay, so now we move on to the supervisor's name, signature, and date. This is a separate section by itself because we cannot stress enough the importance of getting your supervisor's signature on the same day that you're writing the plan. Okay, maybe you can write their names down first here and get their signature on the same day that you're writing the treatment plan. Please do not wait for a few days or a week or months before you get their signature. And make sure you put the date on when this signature was done.